Thank you very much. Let me quickly share my screen with you. Right, Dr. Matsing's already mentioned some of the housekeeping rules. So please feel free to type your questions as you go on the question and answer, and we'll try and answer afterwards. We'll see how we go time-wise. We could possibly have two question sessions, one after the basic questions, basic talk, and one at the end. And if there are any technical issues, please type on the chat. Okay, just to mention that SADA is coming out with their own guidelines. So this training is really a general training about the coronavirus, COVID-19, and SADA will have their specific guidelines. So we're not going to tread on their toes. They will have the specifics, but just generally, we're going to talk to you about the virus and also about testing for the virus. So we're going to start off with a basic talk about the virus, the coronavirus pandemic, and then afterwards we'll get into the more details about testing as well. Right, so there's a lot of confusion about the names: coronavirus, SARS-CoV-2, COVID-19. I'm sure you've heard of these names, and it's a bit confusing. What do they all mean? So coronavirus is really the family that this virus belongs to. Coronaviruses, I'm sure you've heard of before. They're very common viruses. A lot of the little minor colds that people have every winter are caused by coronaviruses. But there are three specific, more severe coronaviruses that we know of. There's SARS, there's MERS, and then there's our virus we're going to talk about now. SARS stands for Severe Acute Respiratory Syndrome. And these two happened earlier on, a few years ago. And the virus that we have now is also part of the same family of coronaviruses. Now, then people get confused with SARS-CoV-2 and COVID-19. So SARS-CoV-2 is the name of the actual virus. The virus that causes this disease has been called SARS, which stands for Severe Acute Respiratory Syndrome. It's because it's very similar to the initial SARS virus. So it's called SARS-CoV-2, which is the second SARS virus. And COVID-19 stands for Coronavirus Disease 2019. So COVID-19 is not the name of the virus, it's the name of the disease. To give you a way of understanding it, similar to the terms HIV and AIDS. Just like HIV is the virus that causes AIDS, so SARS-CoV-2 is the virus that causes the disease COVID-19. But the names have all been interchanged and bandied about, and people will talk about the COVID-19 virus, even though that's really the disease, or coronavirus. So I'm not sure what I'm going to be saying, but whatever I say, you'll understand what I'm talking about. Just looking at world stats, this was accessed yesterday. You can see it's going up exponentially. Okay, we have got 3.6 million cases so far. That was yesterday. It's a bit more today. 250,000 deaths, and it's affecting 210 countries. The graph is showing the total deaths, and it's about a 7% case fatality rate overall. Some countries much more than others, but on average it's about 7%. So in South Africa, this was accessed yesterday, and we have 6,783 cases with 131 deaths so far. So I think it's a little bit more today. And you can see that the provinces, certainly the Western Cape is the worst, with over 3,000 cases. Gauteng, 1,600. KwaZulu-Natal, 1,076. Eastern Cape has come up fairly recently. It wasn't previously thought of as a hotspot, but now 774 cases there. And you can see the other provinces fairly few cases. Right, so that's the story in South Africa. And if you have a look at the curves, you can see that some countries on the right in light blue, such as Hong Kong, Singapore, and Japan, have got very flat curves. Right, they've hardly come up, and they're They are doing strict things in order to prevent the transmission of this virus. You can see on the graph strong social norms about obedience and mask wearing, strict quarantine rules, and they've got pretty good numbers. You can see on all the whole big bunch of colorful ones on the left going up and up and up, and these are the countries that are really struggling with their cases. And then you see South